Hello, my name is Dr. Srikanth A.V. Um, it's a long name, so I guess everybody could call me Shri. And today I'm here to talk to you about the role of primary care physicians in patients who are undergoing rehabilitation for drug use. Okay, so I'm from the Pierre Toussaint Family Health Center in One Brooklyn Health, and we are proud partners with the Office of Alcoholism, Substance Abuse. So over the years, we facilitated education and early detection initiatives for those in recovery. And today, I want to share with you the importance of primary care in the recovery process. And what I'm going to focus on is especially cardiovascular health, which is basically the health of your blood vessels as well as your heart. Okay. So, the first thing that we're going to talk about is what exactly is cardiovascular disease, right? So cardiovascular disease is a broad term that encompasses a lot of different conditions, and it basically is any condition that involves damage or dysfunction of the blood vessels and the heart. And this is generally caused by many factors, the most popular being atherosclerosis, and also things like hypertension, other things like diabetes can also cause it, and hyperlipidemia, which is increased cholesterol in the blood. Okay, so we're gonna delve into a little bit of these conditions because I think it's very important to know some of the issues that will arise in patients that have used substances in the past. Okay, so we're gonna talk about something very common, which is coronary artery disease, and this is actually a buildup of plaque in the blood vessels of the heart that can cause damage to the heart and disruption of flow, which causes pain in the chest and dysfunction of the heart itself. And this could lead to something called a myocardial infarction, which is also commonly known as a MI or a heart attack. And this happens when that same coronary artery disease or something else causes such a decrease of blood flow to the heart that it causes severe damage and dysfunction. Okay, and eventually death of the muscle within the heart. Okay. So, in terms of substance use, um, many of the factors that increase someone's risk for heart disease are related to poor health in general. Okay. And people that suffer from or have had a history of using or misusing substances in the past have lived a life where they haven't put their self-care and their health first. So some of the things that you really need to look out for are health and nutrition within yourself and how you eat, how you sleep. These are all factors that can affect the level of inflammation within the body. And if you have greater levels of inflammation within the body, it can actually lead to factors that cause cardiovascular injuries and cardiovascular conditions or diseases. So some of the things that are very important are extremely good nutrition, um, good sleep habits are very important as well. And people who have used substances in the past generally tend to not have very regular sleep cycles, and nutrition is a challenge for them as well. And so one of the effects of this of having poor sleep habits and poor nutrition is the increased level of inflammation within the body, as I have mentioned before. And also, it decreases your immune system's ability to take care of itself and take care of the body. So, these are things that increase the environment where the blood vessels and the heart itself can get injured. And one of the particular threats to the human body that I would like to speak about is HIV. And the reason I'm bringing up HIV is because people who have shared in the past paraphernalia to inject drugs into themselves put themselves at risk for HIV. And HIV is also known to cause or to have a correlation with things like heart attacks, heart injuries, and also things like stroke. Okay, so this is one of the correlations between having a history of um, drug use and or especially injectable drug use and the things that we as primary care physicians have to look out for. Okay, so HIV is one of those things that we would look out for in people that have used injections or sorry injectable drugs in the past. Okay. In addition to this, there's another illness of the cardiovascular system called infective endocarditis. I know it's quite a big name, but all it really means is that the needles that you have placed within yourself, um, if you were in the past a injectable drug user, the needles itself acted as a conduit for infection to reach the heart. And so physicians, primary care physicians also need to be aware of the fact that this is a possibility. And so if you have things like a low-grade fever, a change in the way your heart sounds when the physician auscultates or listens with the stethoscope, and you have something called stigmata of infective endocarditis, which could be rashes, could be things found in the back of your eye, so multiple things, we would have to test for infective endocarditis. So, one of the rules of the primary care physician is to look out for things that happen after using injectable drugs. So, we also have to look for illnesses such as hepatitis C. But today we're going to talk about cardiovascular illnesses, so I'm going to keep it limited to that, okay? So another thing that we really need to look at is the ability for the cardiovascular system to keep up with the demands of the body. So if you have a history of um, congestive heart failure, if you have a history of having a heart attack, and you have used if you have used drugs or misused drugs, it places additional strain on the body, which can cause worsening of symptoms. So, as primary care physicians, it's very important for us to monitor your progress in terms of your cardiovascular illness. For example, if you have heart failure in the past and you have also a recent history of using illicit drugs, one of the things that we would need to do is to monitor your ejection fraction and the health of your heart. And one of the ways we can do this is by doing yearly echocardiograms and observing the contractility or the way your heart contracts through the ultrasound of the heart itself. Okay, and this is also one of the techniques used to see if there are any bacteria in the heart as well. Okay, um, so even if the substances that you used or the people used in the past does not directly lead to cardiovascular disease, it can lead to other things that can contribute to cardiovascular disease, and that's something that we need to be very mindful of. For example, if you're somebody who has used or misused alcohol quite commonly in the past, then the levels of lipids within the body might be increased, which can lead to cardiovascular illness. So those are things that we like to look out for. Okay, so in general, um, drug use can cause a state of inflammation within the body, which can lead to cardiovascular illness. Another thing that we like to look out for is hypertension. And so hypertension is high blood pressure, and it also causes a risk of many issues. And people who have used upper drugs that are called uppers, for example, cocaine, amphetamines. People who have used these medications these drugs in the past can actually cause hardening of the vessels, the blood vessels, which eventually lead to hypertension. So this is something that we like to monitor as well. Arrhythmia is something also that we would like to look out for. And so the arrhythmia is actually something like an irregular heartbeat, right, or heart rate. And this is something quite common in many individuals, but unfortunately, it's a lot more common in individuals that have used drugs in the past. So this is something we'd like to look out for as well. Usually, uh, using echocardiograms, or sorry, or EKGs, as it's commonly known. It's a tracing of the beats of the heart or the rhythm of the heart. It's not commonly advised to do it proactively without any indications, but in individuals that have a history of drug use, it may be advisable if the patient themselves complain of chest pain or irregular heartbeat to have a very low threshold for using an EKG to see the tracing of the heart itself. Okay. Um, so another thing that we would like to look out for is congestive heart failure. Okay, so people that have had injuries to the heart in the past and have also used drugs in the past, it can be a predisposing factor for heart failure or congestive heart failure. This is when the heart does not contract as much as it should, and there's a buildup of blood throughout the body. So, namely, it could be built up in the heart or in the lungs. So these are things we would like to look out for as well. Okay, so alcohol is another drug that I would really like to focus on because it's one of the most accessible and used substances in the United States, and so many people do struggle to drink in moderation, and it's very understandable because of the degree of availability of alcohol. Okay, so uh, studies over the years have concluded that excessive alcohol use can harm the heart and lead to cardiovascular disease. There are many studies that have confirmed this. The Journal of American College of Cardiology has recently found that people with who are struggling with alcohol addiction have increased risk of irregular heart rate, which is the arrhythmias that we spoke about, heart attacks or myocardial infarctions that we spoke about as well, and also difficulty pumping blood, which is congestive heart failure. It's actually so pronounced that there's something called dose-dependent injury to the heart, whereby the more alcohol you drink is the more injury that is seen to the heart. So that's how strong the significance or the correlation is. Okay, and so alcohol also causes hypertension or increases the blood pressure in your body, and this also contributes to heart disease as well. And so one of the things is about alcohol, it's a very caloric drink, which means that the more you drink is the more weight you put on and the more fat that's deposited in the body. And one of the major risk factors for hypertension is abdominal obesity. So the larger your waist circumference is the higher the likelihood that you will develop hypertension. Also, the more fat deposited in the body is the higher the chance for diabetes, which is also a factor that leads to cardiovascular illness. So these are things that primary care physicians we look out for, and we constantly keep an eye on. Okay, so for example, in terms of uh, hypertension, we do screenings. In fact, hypertension is one of the easiest or most commonly monitored um, conditions. And we do this by using a pressure cuff, which I'm sure most people who've entered the hospital or clinic are familiar with. These are the cuffs that are placed around your arm, your upper extremity, and inflated to see what's the pressure within the body. So it's a very accurate reading, and it can be used. It can be used very commonly, very easily, and usually it's done over two separate visits to confirm if there is increased blood pressure. Okay. And in terms of diabetes, we use something called HbA1c, which can be done either once or twice a year. It's not done on every visit, and it's to monitor how your blood sugars have been maintaining over the last 3 to 6 months. So it's a very effective tool in terms of seeing how you've been taking care of your blood sugars. Okay. So another problem that we'd like to talk about is that people who have used substances usually or more commonly tend to have polysubstance use, which is actually the use of multiple substances. For example, somebody who drinks alcohol usually smokes. Somebody who smokes marijuana may have tried cigarettes as well. So the use of multiple substances can also accelerate the process of injury to the heart because each substance has a different mechanism in terms of affecting the heart. And sometimes you have a coming together of two different mechanisms to increase the amount of inflammation within the blood vessels and the heart. Okay, so one of the most important substances in terms of heart health and how much it affects the heart is cocaine. So cocaine is a very powerful stimulant. Cocaine works by increasing the number of hormones from the ends of your nerves that are being released. So it causes a lot of stimulation. But unfortunately, these hormones can also control the health and the circumference and the health of the blood vessels. So the blood vessels tend to get smaller, and there is an increase in pressure because the blood vessels have gotten smaller. And also, they affect the heart by increasing the rate the heart contracts and how hard the heart contracts itself. So overall, cocaine puts a lot of stress on your body, on your cardiovascular system, and it's one of the most dangerous drugs in terms of affecting the heart itself. In fact, that it's actually been researched and shown that people who have used cocaine only for a very short period of time will have long-term effects in terms of the stiffening of the vessels itself. Okay. So that's something that is very, very important. In addition to those things, so cocaine is linked to the increase in risk of stroke, which I know isn't the heart, but is within the cardiovascular system. Um, so a stroke is actually a decrease in blood supply to the tissues of the brain, which is actually a very, very dangerous condition that should be avoided at all costs, and that depends on the control of the pressure usually. Okay. So another thing that can happen is damage to the aorta. Okay, so cocaine actually causes, so there's a very big vessel within the chest, a blood vessel within the chest called the aorta, which is the supply for the majority of the tissues of the body. And what happens is usually cocaine causes damage to the inner linings of the aorta, which can cause damage and tearing of the aorta itself, and this could lead to very bad chest pain that goes to the back. It can actually lead to abdominal pain as well, which is belly pain, and it could lead to a very catastrophic loss of blood supply. And the reason that I'm telling you this is because it's very important to not know and look out for the very important and dangerous side effects of drug use. And also, so some of the things that us physicians we do when we know there is a patient who has used cocaine in the past and is recovering from cocaine, we do understand that they're no longer at very high risk for many of these things, but it's something that we look out for because in the past the damage has possibly has been done, and it's important for us primary care physicians to look out for these things. So one of the things that is common is the screening for the abdominal aneurysms. So this is basically inflammation within the aorta and the belly, and the aorta again is the major blood supply to the belly. Um, it causes a ballooning of the vessel itself. Because it becomes ballooned, there's a chance for it to rupture. So, what I think is important for us physicians to do as primary care physicians is have at least one screening where there is use of the ultrasound to see if there is any change in the aorta itself in the abdomen. And this usually occurs in older age groups, but if there is a history of use of cocaine, and also there is a history of complaints, for example, such as abdominal pain or belly pain, it would be very prudent to use the ultrasound as a screening tool in terms of these conditions. Okay, so this is very important. And just to reiterate, cocaine is one of the most dangerous drugs in terms of cardiovascular health. In fact, many people who abused or used crack cocaine experience intense chest pain at least once that leads them to the hospital. So most people that have used crack cocaine have been admitted to the hospital with a heart-based complaint, for example, chest pain. And cocaine also causes the increased risk of a heart attack as well as an arrhythmia. Okay, so these are things that we look out for. So we're not saying that as a recovering patient you will have these problems, but sometimes when uh, the patient has used cocaine in the past, these occurrences might have happened. For example, the patient might have had arrhythmia, the patient might have had a heart attack, and it's important for us to look at the aftermath of that and see how we can optimize your body to handle um, these conditions that have had already happened to the patient. Okay. So, especially for arrhythmia, if there's evidence of an arrhythmia, we would like to speak to cardiologists. As a primary care physician, we would like to direct you to cardiologists who can give you a better assessment of the arrhythmia itself. Okay. Um, so one of the things that is very, very important for primary physicians to know and how to treat is the hypertension that comes with cocaine. So the high blood pressure that comes with cocaine is because of the narrowing of the vessels that I've told you before. And what happens is that a common medication used by most physicians is a beta blocker. And there are studies that have been shown in the past that beta blockers can cause a paradoxical increase of pressure in patients who have used cocaine. So when there is a use of cocaine, then we need to be very wary of that. And if there's a history of use of cocaine, we need to be very wary of how we give beta blockers. Generally, there is no problem, but it's something that we should be very wary of. And that's where the use of the pressure cuff and reading your pressures relatively regularly, as well as home pressure kits come into play. Okay. Okay. So one of the more important things that I'd like to talk about is the history of use of injection drugs. So we spoke about this briefly in the past in this video itself about infective endocarditis. And some of the things that patients would experience is if there is a history of injection drug use and there's a low-grade fever that's been going on over a period of time that can't be usually controlled with Panadol. If there is a new change in the way your heart sounds when your doctor listens to it, if there is new rashes, if you have difficulty seeing, if you have darkness at the fingertips. So these little signs can be signs that the primary care physician may look out for to show things like infective endocarditis, which will lead to a very significant workup in the sense that a lot of tests have to be done, and many other doctors, for example, infectious disease doctors, need to be involved as well. So this is one of the serious outcomes of using injection drugs in the past. Okay, so one of the things that this causes is damage to the heart valves. So those are things we'd also like to look out for using the echo cardiogram, which is an ultrasound that we look at the heart. So that's one of the things that are very important. And yeah, so we really very concerned about this as primary care physicians, and it's something that we're looking out for. Okay. Um, right. So so what we just spoke about is the way primary care physicians will handle most cases of specific drug use in the past. And this is for recovering patients. And it's not suggesting that there is drug use currently, but in the past, the past drug use can lead to consequences or injuries to the body that will be lasting, and that's why we're looking out for these things. So we our aim is to prevent negative outcomes, and that's why there'll be a lot of screening tests. There'll be a lot of tests to prevent negative outcomes. It's better to prevent than to treat. Okay, so what exactly do primary care physicians do apart from what I spoke to you before, which is very directed and very pinpoint towards most of the conditions that I spoke to you about and most of the drugs that I spoke to you about. So this is the overall view. Okay, so the initial effort for most primary care physicians, especially in rehabilitating patients, is that we just have to treat the medical issues. Okay, so the medical issues, for example, hypertension, diabetes, hyperlipidemia, it's something called optimization, and optimization essentially means to keep your body in its best shape. Okay, so that's something we're very passionate about, and that's something that we try to do on every visit with our patients. Okay. Um, so one of the things we'd like to look at as well is if there is any signs of relapse and if there's any sign of further drug use as well. So this is very important because studies have shown that um, for patients under for patients who have not been sober for 4 years, there is an increased chance of relapse. So as primary care physicians, our duty is to speak with you on a very comfortable, safe space so we can allow you to express any concerns that you have. And it's very important to have regular follow-ups and regular open speaking sessions where you can voice your concerns, especially with the rehabilitation process. Okay. So what physicians will do is if there's any concerns, we can do brief interventions where we can try and help in any way possible by referring to different physicians that can help in this process of maintaining sobriety and maintaining the rehabilitation process. And one of our best tools is motivational interviewing, where we ask you questions that are open-ended so you can express yourself in the best way possible, and we give you positive reinforcement and tell you that you have agency and you are the person who is in control of your life and your body. And the best thing to do is try your best to maintain your sobriety. And uh, us physicians are here to help you, and we are partners in your healthcare. Okay, so The model that most physicians use is called the Bio Psychosocial Model. So this is divided into three categories. So the bio is the biological aspect of it, which we deal with, for example, the hypertension, the diabetes, the high lipids. Those are things that us primary care physicians can handle because it's something quite common and that's commonly seen in the field. So the other aspect of the bio psychosocial model or the PPS model is the P, which is the psychological aspect of it. So many physicians do recommend the use of a psychologist or a psychiatrist to assist in the process of rehabilitation. It's very important because it's a very psychologically demanding thing. It's a very psychologically demanding thing. Um, so there is usually a psychiatrist involved um, that can help with whatever anxiety that happens or tremulous or anxiety ridden behavior, etc., that comes along with the rehabilitation process because as many can assume that it's a very psychologically tough thing as well. Okay, so it's very important for psychologists or psychiatrists to be involved. The other reason that psychologists and psychiatrists would ideally be involved is because studies have shown that people who have used drugs in the past have been associated with having comorbidities such as depression, bipolar disorder, etc. So it's very useful to have psychologists and psychiatrists on board to assist with those things. And finally is the social model. Okay, the social aspect of the BPS model. So the social aspect comes from the social workers, the people that the people that basically assist you with all the things outside of the medical aspect of it. For example, employment, being in good support groups, being in church groups, having safe spaces, having a place to live, having access to proper nutrition. So these are very, very important things. The social worker is one of the most important aspects of rehabilitation. Okay, and finally, we use a health coach as well, and these health coaches will help you with regarding your nutrition, exercise levels, basically coach you into a better state of health without focusing on the medication aspect of it, which is what the physicians are there for. But the health coaches are very important, cog in the wheel of rehabilitation as well. Okay, so one of the things that they also assist with, if possible, is the problem of unemployment or underemployment in the rehabilitating patient. And these are things that are very important because it's very important to give people a sense of agency in their own life and give them power in their own life to make a living and to be able to provide for themselves. So this is very important as well. Okay, so essentially, that is those are some of the most important things um, that the primary care physician does with and also the team of individuals the primary care physician has to contribute to the well-being of the rehabilitating patient. And what I would like to emphasize is that any rehabilitating patient or patient that's going through rehabilitation, one of the most important things that can happen is to build a very strong relationship with the primary care physician. It's very important to be honest, to have regular conversations at checkups about the rehabilitation process, and to really be open about whatever the patient is struggling with. Because ultimately, we're here to help, and our goal is to make you as healthy as possible. And so those are the things that we're very focused on. Um, Apart from the scientific aspect of it, uh, we as primary care physicians, we would like to be as compassionate as possible, as empathetic as possible, and help in every way we can to ensure that uh, the rehabilitation process goes smoothly. And you know, there's a lot more control. You have a lot more control in the rehabilitation process. Okay, so the most important thing is to come for follow-ups, speak to your physicians regularly, um, express concerns, especially with compliance with medication that you might have to take during the rehabilitation process. Um, Express concerns about things like nutrition, things like sleep, you know. These are very important things for your overall recovery and your overall health. Okay. So that's all for today, and I hope I have helped in any way possible. And I look forward to speaking more on the topic whenever I'm given the opportunity. Thank you.